For me, it was a no-brainer. I knew that it was the right implant to use, and it worked well, and I had good outcomes in my hands. My name is Jamison Glenn, and I'm an orthopedically trained spine surgeon in Encinitas, California. When you're first introduced to it, I think there's a jump that you have to make. And the first jump is understanding that there aren't an anterior plate and screws that you have to utilize. After that, I think you'll realize that, wow, this is a great technology, and you don't have to spend extra time with extra steps. And the more you use it, the more you realize how efficient it can be and how simplistic it really is. So with regard to utilizing this technology, when you look at dysphagia and dysphonia, really that comes from the dissection and the time in the operating room in which you're retracting against those soft tissues. So by utilizing the ROI-C, two things happen. One, we don't have to retract as much because it's inline technology with the plating. Second, your operative time hopefully becomes less like mine has. And so for us, what I see in my OR is less OR time, therefore less soft tissue distraction and compression, and therefore less anecdotal dysphagia, dysphonia issues. When you look at this device, ROI-C, in adjacent level surgery, what I have found is that typically I don't have to even dissect into the old area. I can do the discectomy, do my decompression, and in truth, place this implant with such ease as if it were a native single level and it's not a revision surgery. Some of the pitfalls that I had had with prior systems was, as I said, you have plates that maybe aren't exactly in the position you want it, or it took an extra 30 minutes or more x-rays to put those plates into the proper position. You don't really have that issue with this particular implant design, and yet you still are getting excellent outcomes. When I've used ROI-C at both C7 and T1 fusions, as well as C3, C4, and C7 T1, I'm able to do it in an inline fashion. I'm able to put the plates in from an inline fashion, and because of that, I'm not having to possibly at C7 T1 tilt the screwdriver very caudally and unable to possibly even get those screws in. So for me, it's worked out very well. The procedure is absolutely much more efficient. I find that my OR staff really is able to move through the implants a lot quicker. It's less OR time. And in truth, overall, it's a very simplistic design, less invasive for the patient. And so OR time is less. The OR team thinks it's easy to use, and in my hands, it's been very effective. In my practice, what I have seen is that patients come out of surgery with less anesthesia time. There's less dissection, and although anecdotal, they seem to be doing much better as far as earlier post-op recovery from things such as swallowing and speech and strength of voice and less narcotic use, but yet still having our same clinical outcomes that we've had for decades.